ทีนะคะสำหรับเซสชันนี้จะเป็นเซสชันสุดท้ายของวันนี้นะคะซึ่งเราจะได้มารับฟังนะคะสำหรับหัวข้อที่น่าสนใจนะคะจะมาพูดถึงเรื่องของ advanced Peptides นะคะจะเป็นอย่างไรนะคะสำหรับเซสชันนี้ได้รับเกียรตินะคะจากวิทยากรนะคะที่บินมาไกลจากประเทศเกาหลีใต้ค่ะเพราะฉะนั้นเรื่องของตัวนะคะ Advanced Peptide ที่เราจะได้รับฟังกันนะคะเป็นผู้เชี่ยวชาญนะในระดับ international เลยทีเดียวนะคะสำหรับ Thailand Wellness and Healthcare Expo 2025 นะคะอยู่ตอนนี้แล้วก็ขออนุญาตเรียนเชิญนะคะที่บริเวณเวที Main Stage นะคะในตอนนี้ได้เลยค่ะแล้วก็ที่สำคัญนะคะสำหรับเซสชันนี้เดี๋ยวเราจะมาให้ทุกท่านนะคะได้มาสัมผัสนะคะถึงเรื่องของความน่าสนใจนะคะเกี่ยวกับการที่จะมาสร้างนะคะการดูแลผิวที่ดีขึ้นกับ Advanced Peptide หรือว่า Peptide ขั้นสูงนะคะมีขนาดเล็กแต่ว่ามีประสิทธิภาพช่วยในเรื่องของการเสริมสร้างความแข็งแกร่งแข็งแรงให้กับผิวนะคะแล้วก็กระตุ้นในเรื่องของการสร้างคอลลาเจนนะคะอีลาสตินช่วยความยืดหยุ่นแล้วก็เคราตินจะช่วยในเรื่องของการเพิ่มโปรตีนให้ผิวแข็งแรงนั่นเองค่ะเซสชันนี้จะเป็นการบรรยายในภาคภาษาอังกฤษนะคะเพราะฉะนั้นท่านไหนที่สนใจเรียนเชิญที่บริเวณด้านหน้าเวทีได้ณบัดนี้เลยค่ะ so welcome back up here on the main stage we would like to welcome each and every one of you who would like to know more detail in the advanced technology that's called advanced peptides which is we have an honor to hear from the experts who have flew away from the South Korea are going to share his expertise right here on the main stage so now this session we will explore one of the most innovative frontiers in skincare for advanced peptide. So the peptides are tiny but powerful in building blocks that play a major role in the skin health. And today we are going to learn more detail how it can help to stimulate collagen, elastin, and keratin production, which is a very important for the maintenance firm, youthful, and the resilient skin. So now here I would like to take this opportunity to invite the Dr. Danny Park from the Korea Vietnam Exchange Development Committee are going to come up here up on the stage and deliver his expertise and knowledge for all of us ขอเสียงปรบมือนะคะให้กับดร. Danny Park ค่ะ
Hello everyone. I am Dr. Danny Park. I am pleased to join you in Thailand Wellness and Health Fair Expo. Yeah.
Hello everyone. My name is Rohit and today I will be supporting Dr. Danny Park in his presentation over the topic longevity and also on the collagen production.
Yeah. Now, could you introduce me too? Huh?
Sure. So I would like to introduce Dr. Danny Park from Korea. He is currently the CEO of Kim's Clinic and also a professional in skincare and aesthetic cosmetic surgery for last 10 years. And now he is based in Vietnam and also holding the businesses for Korea.
자, 이 사진을 보시면 5살 어린이와 50대 여성분이 똑같이 주름을 지긴 하는데 왜 50세 여성분들만 주름이 생길까요?
So the first question which I would like to put up for all of you is that what do you think what is the reason that a 5-year-old baby and a 50-year-old person whenever they shrink their skin have the same kind of design? So what is the reason?
네, 그것은 바로 콜라겐이 없기 때문입니다.
So anyone? Can I have the answer? Okay, so this is just because of the collagen. Okay, so the collagen is the main property which is actually creating such kind of a structure.
It's caused by the lack of collagen. 예. 자, 20세 중반부터는 매년 1%씩 콜라겐이 감소가 됩니다. 이렇게 콜라겐이 감소가 되면 볼륨도 줄어들고 그리고 주름도 생기고 그리고 피부가 처지게 되죠.
So why we need to study this collagen property in anti-aging is just because of the aging factor which goes on with the collagen production. So as you can see that at the young age when we are about 20 to 30, that time, like after 18 years old, the collagen production will start to decrease down by 1% every year.
자, 이것은 펩티드 타입, 스킨 타입인데요. 이것은 그 사람들이 UV에 노출되었을 때 얼마나 피부가 잘 화상을 입고 피부의 색소가 잘 생기는지에 따라서 분류된 겁니다. 동남아시아 사람들은 보통 이 타입에 3번에서 5번에 들어가게 되는데요. 이런 타입 같은 경우에는 쉽게 염증이 생기고 그리고 색소가 쉽게 생깁니다. 그래서 시술을 할 때는 아주 최소한의 침습으로 시술을 해야 됩니다.
So whenever we talk about the collagen production, the first thing which everyone would like to know is that why it is related with us. And the first thing which we really need to know is that what is your skin type and how is it affecting the collagen production.
자, 오늘은 여러분들께 설명할 이 제품들은 임상에서도 많이 사용되고 있고요. 그리고 동남아시아 사람들에게도 많이 사용되고 있는 안전한 제품에 대해서 설명해 드리겠습니다.
So here you can see there are different kind of factors which are basically the treatments which can be introduced to a person to stimulate the collagen production.
자, 이 제품들은 콜라겐을 생성시킬 뿐만 아니라 볼륨도 생성시킬 수 있는 제품들입니다. 그리고 PDO, PCL, PLL 같은 경우에는 볼륨을 생성시키기에 여러 시간이 많이 걸리지만 칼슘 하이드로헤퍼타이트 같은 경우에는 콜라겐 생성과 함께 볼륨도 같이 즉시 생성시켜주는 제품입니다.
So the collagen production over here, there are most common mechanisms which are present as PDO, PCL, and PLLA, which are most commonly administered to a patient. And then we have the CAHA, that is more by like the frequent volume therapy, and it's different in terms of the volume which we inject into the patient.
자, 이것은 우리가 일반적인 방법으로 눈 밑에 있는 볼륨을 채우는 방법입니다. 보통 HA 필러를 사용하게 되죠.
So here we have the case study of first patient which got HA filler. So just before explaining his main thought, can I ask anyone that where can you see the difference between two pictures? In here? Is it the cheek or is it under the eye? Cheek. Okay. Anyone else? Under the eye or somewhere?
The two sides is under the eyes and the nasolabial fold over here and over there.
Yes, so it's actually under the eye. It's not really on the cheek. Okay, next question I would like to ask you is that how much time do you think it takes to get from that to this? What do you think? How much time it takes to get from picture 1 to picture 2? 1 week? Okay. Just after the treatment. So same day. Okay. Anyone else? No. Okay. It's actually on the same day as you can see over here. So on the same day of the procedure.
Yeah. This one first. Okay. Yeah.
The first one?
Yeah. This I will explain this one first.
Okay.
Yeah. 자, 이 사람은 23세 여성 환자분으로서 베트남 사람입니다. 동남아시아 여성분이죠. 보통 동남아시아에서는 20대부터 이렇게 눈 밑에 꺼져 있는 불만상을 가지고 클리닉에 오시는 경우가 많습니다. 이럴 때는 필러를 사용할 수도 있지만 필러보다는 콜라겐 스티뮬레이터를 사용하게 되면 좀 더 자연스럽고 오래 지속되는 결과를 얻을 수가 있습니다. 이분 같은 경우에는 저희가 PLLA라는 콜라겐 스티뮬레이터를 사용하였고요. 이것에 대한 결과는 한 달이 걸렸습니다.
Okay. That's a lot. Okay. So in the first picture and second picture, same question, what is the difference you think? The first picture and second picture, what is the main difference? Eyes? You mean the lips? Ah, the wrinkle. Okay, I don't see the wrinkle. Okay. The nose is red. Oh, that's just a shadow. That's only the shadow.
On the right hand side me
Okay.
is red.
Okay.
That one is white.
Correct. But that's not the effect. It's just the photo.
Oh,
But the main effect, can you see? The eye. Okay. Can anyone tell me what we call it normally in a woman's word? In your normal language, how do you call this bulging of the eyes?
bunching of the
Eye bags? No. Eye bags on the upside. Anyone?
I don't understand your question.
The thing which you can see under the eye, there is a swelling kind of thing. Can you see in the first picture?
Uh-huh.
What do you normally call it? Like if you go to meet to a doctor, how will you describe it? Like, I got this as a problem.
I got that.
Anyone?
A wrinkle. A
Wrinkle? No, this is not wrinkle. So why I ask you this question is because normally people think it as a wrinkle, but it's actually the howl eyes.
Pardon?
Howl eyes.
I don't understand.
It's the name of this thing. It's called howl, Howel.
Our eye.
Yes.
Thank you.
And that's a swelling which makes you look older than your actual age. So if your age is, let's say, 20, but due to some reason you got this, you will look like 25 or maybe 30. It's because of that. Okay. Next, please.
You don't say that how long time taking this one?
Yeah. How long time do you think it takes from getting from that to this? One day. Okay. Any other answer? 1 week? 1 month? 1 day, 1 week, 1 month. Okay. That's a good. It's actually taking around 1 month. Exactly 1 month. Okay. Next, please. Yeah, this is even difficult for me as well. When I saw these two pictures, I can't understand. Can you find the difference between before and after? Under the eyes, okay. Yes,
Yeah, it's under the eyes.
under the
Yeah.
eyes, okay.
Yeah.
So, same question. How much time do you think it will take to get from picture A to 2? 1 month? Is it 1 month? No? Okay, another guess? 2 weeks?
No.
Okay.
This case is a 2 times procedure and taking the 3 months.
It's 2 times session in 3 months' time. Okay, so total time is 3 months to get from that to this. Okay,
일반적으로 이런 고객 같은 경우에는 수술이 퍼스트 초이스입니다. 그러나 고객이 수술을 하는 걸 원치 않아서 저희가 PDO 콜라겐을 2 타임 2번 시술을 했고요. 2번 시술 후 2달이 지난 상태입니다. 그래서 총 3개월이 걸린 거고요. 이제 이분 같은 경우에는 시술 후 2개월 있다가 병원에 컴플레인을 가지고 내원을 하셨습니다. 왜 컴플레인을 가지고 내원을 하시고 why she came to clinic again why have the complaint?
okay.
How do you think?
So the first question he put up is that normally when we see this medical case, people would like to have something easy process. Okay, they think like it's easy just to remove something from here and you get a normal eye. And normally people don't choose for the surgery. Okay, so in that case, he as a doctor and as an aesthetic professional would recommend 2 sessions of PDO collagen stimulator to get this same effect. If you choose for surgery, it can be achieved in less time. But if you choose as a normal method for PDO, it will take almost 3 months.
But she came to clinic after 2 months. She had some complaint about the bulging pad over here. Do you see that? A little bit bulging over here.
So after she got this treatment, she came back to the clinic and she complained that she got a little bit of the same problem still over there.
Yeah, because this procedure taking time, so the custom don't remember the first pace, you know. So she have the complaint about this one.
So, okay, basically, when it is taking 3 months of time or 4 months of time or maybe 5 months of time, even patient who come for the treatment, they forget how they actually looked 3 months before. So this happened with the same case that the lady actually forgot that how her face was 3 months before. So she thought that there hasn't been any much changes. And that's why she come back to complain that I need more results.
You know, at that time, I showed the first picture. Yeah, she said to me, "Oh, I'm sorry, I didn't remember my face before," you know.
So skincare and activation of the things and to get a face which actually a woman desire is totally different from the expectations. So sometimes it takes time. It takes really good values to understand that when you are getting a treatment, you need to believe in what you are getting. Okay.
그리고 이제 아까 같은 눈밑 시술 같은 경우에는 시술자가 경험이 없다면 피디오 콜라겐을 사용하는 게 더 좋습니다. 물론 지속 기간이 짧기는 하지만 부작용이 생겼을 때 그만큼 더 빨리 해결할 수 있는 장점이 있기 때문에 보통은 초보자분들은 피디오 콜라겐을 시술하는 게 더 좋습니다.
Okay, before I explain that thing, any one of you ever visited clinic for a collagen treatment? Anyone have experienced it before? For the collagen treatment or collagen stimulation, anything? One? Okay, I see one. What kind of treatment was it? Can you just share a bit? Can you hold the mic, please, at the back side?
I did the HIFU one, the HIFU program.
HIFU.
Yeah.
Okay, that's coming up. That's really literally coming up. Okay, for this one, basically PDO we use, but PDO have one advantage that its side effects are lesser compared to the other ones.
Yeah. 이제 다음은 우리가 피부에 직접 주사를 해서 피부에 콜라겐을 재생시킬 수 있는 스킨 바이오 스티뮬레이터에 대해서 설명해 드리겠습니다.
So there are different kind of biostimulators. If you go to any clinic and you ask for such kind of treatment, normally they would suggest you either of these 6 options. Okay, and now we are going to explain a bit about each 6 options, how they really works and a slight difference between each of them.
보통 PLLA 같은 경우에는 볼륨을 만드는 거지만 부피와 그 농도와 크기를 줄여서 스킨에 맞게 사용할 수도 있고요. PCL 같은 경우에는 처음에 나올 때 액상으로 나오기 때문에 그 마이크로 인젝션이 바로 가능하게 됩니다. 그리고 PN과 PDRN 같은 경우에는 아마 여러분도 들어보셨도 아시겠지만 유주란 같은 제품이 있는데 이거 같은 경우에는 아데노신 A2A 리셉터를 자극해서 섬유 아세포를 자극하고 그리고 그것이 다시 콜라겐을 재생시켜서 피부의 장벽을 회복시키고 염증 반응을 줄여주고 콜라겐 생성을 유도시킵니다.
Okay, so next time whenever you go to any clinic, you will have 2 kind of options. So one is PLLA and the other one is PCL. So PLLA, correct?
Yeah, PLLA and the PCL is both. It's possible to injection in the skin.
Correct. Okay, so PLLA basically means that, as per my knowledge, I'm sharing, that PLLA is kind of a direct skin booster. It's something which can easily dissolve and it can be easily replenished. But when it comes to PCL, it's more in a liquid form and it stays under the skin for some time. So it gives a kind of a structural stability more than PLLA.
PLLA, polyl lactic acid have two types. One type is a for volume, one type is a skin booster. Skin booster is the particle is less and the density is less. So it's very easy to injection to skin.
So the first product, PLLA, is basically working as a skin booster. Its particle size are less, small, and it's easy to administer into the skin. Okay.
아마도 PRP는 많이 들어보셨을 겁니다. PRP는 환자들의 피를 뽑아서 거기에서 원심 분리기를 사용해가지고 플레이트릿이 많이 들어있는 혈장을 뽑아내죠. 여기 이 혈장에는 성장인자들이 많이 들어있기 때문에 이 성장인들이 콜라겐을 재생시키고 그것으로 인해서 피부가 좋아지게 됩니다.
So in this process, platelet-rich plasma, PRRP, we have a kind of system in which we take our own blood, we centrifuge it. Centrifuge basically means that you rotate it at a very high speed so that it can, separate into its component, into its different part. And then we have the plasma, which can be directly injected into the skin. So it's kind of like you are taking out a part of your own blood and injecting again to solve the problem.
다음은 엑소좀입니다. 엑소좀 같은 경우에는 세포에서 분비되는 작은 소포체인데요. 이 소포체 안에는 단백질 그리고 성장인자 그리고 mRNA 등 여러 성분이 존재하게 되는데 이런 존재하는 성분들이 콜라겐 생성을 자극하게 됩니다.
Okay, so how many of you have ever heard about exosomes? One I see, okay. I think it's more common in Thailand, as far as I know. I'm not sure. Okay, just one person. Any idea about exosome? Can I have the mic, please? Okay.
So since I'm also study biomedical science, so I know like how the exosome work. So it's pretty I think it's very new for Thai people because it's just emerged and most of the people will heard it as a tool to reboot or maybe treat the skin conditions regenerative, more like the regenerative, not just for skincare but also other disease complications.
How is it? Is it correct? Okay, so maybe we can just give it a good try to that. Thank you so much.
Thank you.
And just on a simple explanation, exosomes are basically trying to have two kind of derivatives. Either we take it from the animal side or we take it from the plant side. Animal side are more proven, it's more having clinical data, it have more statistics and have more results to prove. But when it comes to plant, all the extracts are still under the clinical studies. The data is limited, so we can still rely on the animal side more. Thank you, sir.
Thank you. This is a microbotox. 마이크로보톡스 같은 경우에는 피부 자체에 보톡스를 소량씩 주입하는 건데요. 근육에 영향을 주지 않고 미세 근육을 완화시키고 그리고 땀샘과 피지선을 분비를 억제시켜서 콜라겐이 생성되기 좋은 그런 환경을 만들어주게 됩니다. 그래서 규칙적으로 이것을 받았을 때 콜라겐이 생성된다는 논문들이 있습니다.
Okay, so that's a lot of explanation first. Again, I would come back to our audience that what do you think what is actually Botox? Have you heard about it before? I think Botox are also quite common. Anyone heard about it? Botox? Okay. Just give it a try. What do you think about Botox?
The Botox was help about to not enlarge, but how to say to make it stay, to make the in forehead, so it's just no lines and stuff. Yeah.
So no lines means
No
no
lines.
wrinkles.
Yeah, no wrinkle. Yes.
Okay, got it. Anyone else would like to try? Oh, sure.
Is a Botox is just relax the muscle, right?
Yeah, paralyzed muscle.
Parallel.
Yeah. Last week I took the Botox in my forehead.
Wow.
So he is the live example of this thing for you. Okay, so just to explain quickly, basically we are not going deep inside the skin. We are just injecting the treatment near to the skin. So it's kind of like very small quantity pinched at different spots at the same time. So that's actually the principle of Botox.
칼슘 하이드로 에퍼타이트 같은 경우에는 생리식염수와 리도카인을 희석해서 진피층에 골고루 뿌려주면 이 진피층에 콜라겐을 생성시키고 피부 상태와 결을 개선시키는 효과를 가지게 됩니다.
So CAHA basically is like more bigger size of the particles, bigger size of the treatment, where we inject deeply inside the skin and in a greater volume, in a greater quantity, in a greater concentration. So when that goes inside there, that stays inside there for a long time, and then slowly it dissolves, and that makes the stability more comfortable and more longer.
그리고 콜라겐을 생성시켜주는 기계적인 방법도 있습니다. 기계적인 방법에는 아까 말씀드렸던 하이프와 RF가 있습니다.
Okay, now I'm coming to your thing that, okay, we have other methods as well. The first one you can see is microneedle. Then second one is non-invasive. And the third one is HIFU, which you mentioned.
하이프 같은 경우에는 고강도 초음파로 조직에 열을 전달해서 이 전달된 열이 콜라겐을 생성시켜 주는 겁니다.
Okay, before I go to that, when you see this picture, is it looking clear to you? Can you tell me what are those white lines? Any idea? The white lines. There are 3 lines I think you can see in the first picture, second, third. There are 3 lines going deep inside. Sure.
Is this a source of like wave or like the energy or heat?
Source of wave or energy. How do you think?
Yeah, it's the ultrasound is a focusing.
Ultrasound wave, right?
ultrasound. The high density ultrasound focusing on the tissue. It's making the looks like the. Do you know the sunshine and you're using the glass?
Yeah.
And focusing and making the fire. The same. This ultrasound is focusing and inside the tissue making the fire. You know, this making this prominence making the collagen.
So basically, as you can remember, if you study in the basic sciences, that we use the micro lenses to focus and redirect the sunlight on a particular point, and it gives a heat, okay, just to burn it up. And that's the same principle we are using it, that we are focusing the concentrated heat rays on a particular point. Either that point can be near to the skin or deep side on the skin. And that's how it really works.
RF 같은 경우에는 2가지 타입이 있습니다. 하나는 침습적인 타입이 있는데 이것은 바늘로서 RF를 피부에 직접 자극해서 피부를 재생시켜 주는 게 있고요. 또 하나는 비침습적인 방법이 있는데 써마지가 비침습적인 방법 중에 하나입니다. 그 모노폴라 RF인데요. 이제 이렇게 비침습적인 방법은 모노폴라, 바이폴라, 프랙셔널 RF로 이렇게 3가지 타입으로 있으면서 여러 가지 층에 있는 콜라겐 생성을 자극해 주게 됩니다.
Okay, so in here we have 2 types. One is the invasive and one is the non-invasive. So invasive basically means, anyone explain a bit? No. Okay. So invasive basically means that you are entering and pinching, or you can puncture the skin to deliver the material. But non-invasive basically means that you are not puncturing or not injecting anything, but you are just using the heat rays to solve the problem.
이 기계 같은 경우에는 아까 말했던 스킨 부스터를 할 때 많은 제품들이 통증이 심합니다. 그러나 이 제품은 바늘 길이를 조절해서 통증을 완화시켜주고요. 그리고 여러 가지 약물들을 한꺼번에 혼합해서 주입할 수 있는 장점이 있습니다. 그래서 통증에 대해서 민감하신 분들에게는 이 제품을 이 기계를 사용해서 인젝션을 하는 것이 도움이 됩니다.
So whenever we think about any kind of like different solutions related to skincare, aesthetic, and all kind of fillers or Botox, anything, the first thing we think and the first thing comes into our mind is that when I do this, will it cause me any kind of pain? Because normally we have seen pictures where blood is coming out and it look really scary to me, at least to me. And I feel like, no, it's not really for me. Maybe I should use some other technique or something easier. So that's what, when we use such kind of devices to make either the pain less or to remove the pain procedures.
그리고 이제 컨비네이션 세라피가 있는데요. 보통 고객분들이 병원에 오게 되면 한 번에 여러 가지 시술을 받기를 원합니다. 그렇기 때문에 이럴 경우에는 어떤 그냥 단순히 시술을 여러 가지만 주는 게 아니라 시술되는 부위, 깊이, 피부 자극 등을 고려해서 그것을 적절하게 콤비네이션해서 고객들에게 해주면 좀 더 드라마틱한 효과와 결과를 볼 수 있게 됩니다. 시간도 줄일 수 있죠.
The combination technique, when we call the combination trend, is actually administered when we think that combination of different things can solve out the problem. But it's not really like that. Whenever we think about taking a medicine for, let's say, there is a separate medicine for head pain, there is a separate medicine for throat pain, there is a separate medicine for stomach pain. So same is the thing here, is that whenever we think about the combination trend, we use the selective strategy for each kind of problem and each kind of treatment, depending on what is the main issue and what is the main target. Okay, so that's our final slide. I would leave it to Dr. Park now to interact with you. Anyone got any kind of question related to the topic, related to skincare, related to your skin needs? Please do have a talk with him.
I want to say about this one. The collagen stimulation is a very safety and it's very good. I regularly taking the collagen stimulation on my face. It's 2 months ago I take the collagen stimulation over here because do you think how old am I?
Okay, can you guess how old is he? Yeah, that
40.
40?
Thank you.
Any other guess? 45?
Thank you.
Okay, even I don't know what is your real age.
I am 48. Yeah, I'm taking the regularly the Botox and the skin collagen stimulation and the making the volume collagen too.
So he is basically using the best treatments by himself. So I think he is the live example, the role model of youthness over here.
It's a very
Anyone
good
would like to share anything? Okay. So
Thank
I
you.
think we are done with the topic, and thank you so much everyone for listening to us. Thank you for giving your valuable time, and thank you the organizers for inviting us over
Thank you.
here. Thank you so much.
ขอบคุณค่ะ Okay, thank you very much. Doctor, could you please remain on stage? Which we would like to express our sincere appreciation. Now I would like to invite our CEO once again to come up on the stage. Please welcome คุณนรินทร์ทิพย์วิริยะดิษฐ์กุลนะคะ CEO of PMG Corporation Company Limited สำหรับเรื่องของการที่เราจะดูอ่อนวัยอ่อนเยาว์นะคะแล้วก็สุขภาพผิวเฟิร์มและแข็งแรงนะคะในเรื่องของการที่จะช่วยกระตุ้นนะคะทำให้โครงสร้างของคอลลาเจนนะคะหรือว่าแม้แต่ตัวอิลาสตินความยืดหยุ่นเองนะคะมีหลากหลายเทคนิคแล้วก็เป็นเทคโนโลยีนะคะขั้นแอดวานซ์ที่น่าสนใจวันนี้นะมาอัปเดตได้ฟังกันแล้วนะคะก็ในเซสชันนี้ขอบคุณอีกครั้งหนึ่งด้วยค่ะ Right, thank you very much for all your participation, your attention. For more detail, please feel free to contact like our professor in person. And we hope that you can have a great time to enjoy your spending time here and receive the knowledge from our experts. So this is the second day of our event of Thailand Wellness and Healthcare Expo 2025. We still have another 2 more days for you to explore more details and find the business opportunities, which is we have more than 170 business companies, business brands that are going to expand your opportunities with every one of you. So now I would like to say a big thank to all the sponsors, and then we will have the gala dinner at the networking night for this evening as well. And for tomorrow, we still have a lot of interesting sessions, starting from the morning session at 10:30 until around 5 p.m. So you are all invited สำหรับในช่วงนี้นะคะเราก็จะมาเข้าสู่ช่วงท้ายกันแล้วเดี๋ยวยังไงขออนุญาตย้ำนะคะในเรื่องของหัวข้อที่น่าสนใจที่จะเกิดขึ้นในวันพรุ่งนี้ครั้งหนึ่งก็อยากจะเรียนเชิญนะคะว่าสำหรับท่านไหนที่อยากจะฟังนะคะไม่ว่าจะเป็นทั้งหัวข้อนะคะของเรื่อง heart problems นะคะ how patients suffer